Welcome back to Credentialing Chronicles, where we spill the doctor's tea hotter than your morning coffee.
And give you the insider scoop on the wild worlds of credentialing, provider drama, and everything they don't teach you in med school.
I'm Shannon, and she's Nyleen, two credentialing pros with front row seats to the chaos, looking to make you a part of it. Yes, we want you to engage in spilling this tea with us. We need your love and likes, and we want to know what you think too. Look for us, please, on LinkedIn, Instagram, and yes, baby, even TikTok.
Yes, we love to see your love. From fraud scandals to burnout breakdowns and why your favorite surgeon might actually be banned from 5 hospitals.
Honey, we've got the gossip and the practical advice to keep you out of trouble and ahead of the game.
So grab your coffee, your compliance checklist, and maybe a lawyer, and let's get into it.
Hey, welcome back to season 2 of Credentialing Chronicles. Ooh,
oh my goodness. So amazing, Shannon, that we've gotten this far. I'm so excited.
I know, walking into the new year with 10K.
Yes, ma'am. And we're hoping to only grow from there. And I'm really excited about our theme for season 2, because I think we're going to touch a little bit of everybody.
Everybody, honey, we are bringing the entire United States together and what we are calling spilling the tea across America, honey.
Oh,
You want to explain it? You want to explain it to the listeners?
Yes. So what we're going to do, we're going to take the weeks of the year. We're going to basically talk about each state every week, 52 weeks, every state plus DC and Puerto Rico, because we know there is plenty of tea to be spilt across the United States. There's all this medical and credentialing drama.
And if you've ever tried to look for an education verification out of Puerto Rico, honey, woo! You know it's not easy, okay? So we're gonna spill the tea.
Yes. So we're going to talk about different topics in each state, right? So we're going to cover payers, hospitals, issues with the board, doctors that killed somebody,
The associations of each state.
tell you maybe some issues with like Blue Cross in the state.
Yes, how we navigate it. You know, Nyleen's big in Georgia right now. Big Florida right now. You know, she's in these different states working with different clients in these states. And so she's out here, you know, really navigating the different payers and what we're doing. Me, I'm working in Pennsylvania. So I'm like, oh my God, going through all these things in Pennsylvania. So we're going to bring our insight as we're in the state, right?
Yes, just so you guys know, we're going to try and go in some kind of order, which we're going to start with kind of alphabetical, but we're going to be adjusting, the releases.
Tell them.
We are going to be live in states across America. So when we go to your state and be the keynote speaker or invited speakers, when we go to your state and do a live episode, we are going to spill the tea of your state.
I mean, you understand, we are repping your state. We are wearing the jersey. Okay. We're just coming out straight. We're putting together a live show for each state that we've been invited to. Check back as we get more into our season, and we're going to let you know what states we're being invited to, right, Nyleen? I think we're up to like 3 right now, 4.
Yes. So just stay tuned. So you
stay tuned.
Yes, you do not miss where we're going to be. And if you want to come see us in person, meet us, hang out, we would absolutely love that. And we want to hang out with you guys, and you know, we feel your
Plan
pain,
a karaoke night. Nyleen is so good at karaoke. I'll be right here drinking my little margarita, okay? So you plan that karaoke night because we're going to be there, okay? Look at Nyleen. She's so excited. Okay, but really, this is what? This is transparency. Because as we go through the states, we're going to be really talking about the different things, that Nyleen mentioned. Hospitals, like, what did that mean? Who are the big players in that state? Who's really controlling stuff in that state? The boards. Is it a fast acting board or is it a slow acting board? And safety. And we're really going to look at what's wrong with the systems in each state and how we can, maybe provide some professional opinions of ourselves. And then Nyleen's favorite, the killer doctors in every state.
I love the killer doctors. Listen, I am a total crime lover. So guys, I'm going to look for all the hot stories, okay? Yes. I'm sorry. I want to know who did what.
Today's sponsor is HST Pathways. And if you work in or with an ASC, you already know this name carries weight with it.
Yes, absolutely. I've used HST firsthand while running an ASC, and a lot of my current clients are on it too. What I loved most was taking messy, manual, error-prone processes and turning them into clean, streamlined digital workflows.
And this isn't just one little tool, right? HST is an all-in-one ASC platform. They do billing, scheduling, inventory, electronic charting, analytics, the whole operation, baby, under one roof.
Exactly. When you're trying to be proactive instead of constantly putting out fires, having systems that actually talk to each other matters.
With over 1,800 ASC customers, HST isn't new to this, baby. They have proven this.
Yes, so if you are ready to level up on your ASC operations, reach out to HST Pathways and let them know Credentialing Chronicles sent you.
So I'm excited. We're kicking it off, right? Alabama, right? Alabama's up first, number one state.
Yes. Let's start where people don't expect too much noise, right? It's kind of like a backwoods, soft, quiet state in the middle of down south here. We don't really hear too much about Alabama. But we care about Alabama, right? Because we love our MSPs out of Alabama.
Yes, we do. Working hard, keeping all the compliance. I mean, really, when we're talking about Alabama, right, there's 5 things that kind of really matter, I guess, when we're looking at the scope, right, of what we're talking about. So let's just put it out there. I mean, Alabama Medicaid, right? So it's for all kids. It's a Medicaid agency. They're slow, opaque, high impact. The patients wait, the MSPs are out there chasing, and, I think it directly affects providers, right? If you're a provider and you're listening out in Alabama or you're an MSP, please comment, because are the providers losing revenue? Does this equal lost revenue, right? I mean, isn't that what you see, Nyleen, in the practices that you're out there helping get out of these lost revenue cycles?
Yes. And so Alabama is one of the states that, we know that the income level, right, the average household income is a little bit lower than a lot of other states. And so there are a lot of people that qualify and need to apply for Medicaid. So a lot of the providers there in that state have to go through this enrollment process. And what we found is that there's a lot of inconsistent responses depending on who you're trying to reach to enroll in Medicaid. Honestly, I don't think it's just an Alabama issue. Medicaid enrollment is an absolute nightmare. But what happens is when Medicaid delays, then that delays access to healthcare. Alabama Medicaid feels like from the trenches. It's not a process. It's like a mystery novel, right? Except the ending is always the same. Patients waiting, MSPs, begging for updates, and then, providers like watching, trying to like, am I going to get in? Am I going to get in?
And I mean, that's the thing, right? If you're calling a payer and they can't tell you where the credentialing process is at, with efficiency, with an efficient ETA, right? Then how are you able to know and be able to project your billing, And I know a lot of Medicaid programs retro, 30 days, 90 days, depending upon the different programs. But again, it just depends on when they come back with that retro. If you're retroing all the way to April and they only retro you to June, that's lost billing, right?
Oh, yeah. And so I feel that sometimes MSPs get blamed, right? That it's their fault that it's a delay in application, but no.
They get all the pressure. Where is it at? Where, why aren't we approving? Where is it at? Where, and
you deal with that every day.
Every single day we deal with that in the CVO, because when the people come in, the first thing that they want is promise me we'll get active in 60 days. Promise me we'll get active in 90 days. And I say, I can't promise you. I mean, I could tell you that every day, we'll do this, we're going to do that. We'll put you on every email. You'll see every follow up. But ultimately, I can't make these people move faster. Now, there are things that we can do, and I'm going to give you a little tea, okay? If you are getting delays, and let's say you're at 65, 75, 85 days, and you're not getting a responsive answer back, looking for a representative within your Department of Insurance for that state, and like tagging them in on your emails, usually will get somewhere. And, you're like, hey, I have put the Alabama Department of Insurance on this email. You are creating a hindrance to patient access, and when you start talking with that type of language, things start moving a little bit faster. You're not just some person.
Go right to the top.
Mm-hmm. Say it. So
I did a little research because you know me, I love doing research, right? So, all right, let's
because you didn't have enough going on, you had to research more.
Of course. So Alabama's median household income is about $60,000, according to the census. And this is as of 2023. So that means about 1.1 million people, 22% of the state's population, were enrolled on an average in Medicaid in 2024.
They meet that qualifier.
Correct. That's a lot of people.
I was just thinking that is a lot of people. But I guess if you have a state that is not actively, pushing higher minimum wages and things of that nature, right? Then that you're kind of creating that system. I think, right?
And then they have this kids program. It's called the CHIP program. And so Alabama's CHIP ecosystem in 2024 basically enrolled about 181,000 children.
That's a lot of kids.
It's a lot of kids. And then it says there was over $312 million in claims paid through this Medicaid program. That's a lot of money flowing through the systems.
That's a lot of money. Mm-hmm.
Or they have a lot of sick kids going to the doctors and hospitals. I don't know. So, that's a lot to know. So is it an important system, healthcare product for patients to get care and for doctors to have to enroll in and accept, obviously, the lower payment? Because y'all all know doctors don't get full price when they take Medicaid.
No, unfortunately.
We don't even get Medicare rates. We have to deal with, lower Medicaid rates in order to provide this healthcare to the patients. But anyway, so big system. So when the system is slow and opaque, it's not a niche inconvenience. It's like a statewide access and revenue problem because everything is going to affect the bottom line and just the entire system. For a healthcare system that is so costly, it's so backwards half the time.
And then families and practices aren't told what to expect, They're not told, hey, we're, anticipating in the next 90 days bringing 3 doctors on and being able to, have a full panel of patients. So they can't plan the care. They can't schedule out the providers. It kind of hurts referrals, because they're not being able to refer people out efficiently. And then finances, always bottom line. The doctors need to be paid in order to keep these clinics open. At the end of the day. And that's where credentialing comes in. Everybody says credentialing, how does it affect the bottom dollar? It's like, this is how it affects the bottom dollar, everybody.
Yes, exactly. So you can tolerate a long timeline if it's clear when, if you can expect for that. But the uncertainty is really where the injury happens to not only, like we said, not only the patients, but these doctors and our offices and then the girls and guys that work in them. Everybody wants to get paid.
Yeah, if you're an office manager listening to us, if you're an MSP that works on contracting, I don't know. I seen all those newly certified provider
CPE
enrollment, like Nyleen herself. So if you work in that and you are listening to that, please comment, okay? Because we want to know, what are you doing? How are you scheduling? How are you doing these things? Because the one thing that we know is that people in our position are going to find a way to work around it, baby. Right? I mean, that's it. We're going to find a way. And that's what the doctors, the owners depend on. That's what everybody is depending upon MSPs is, what is the way? Mm-hmm.
Okay. So you had mentioned something about like retroactive, and like retroactive Medicaid and all of that. So I guess it's supposed to reduce the harm when people qualify, but like apply late. So retro-eligibility can cover up to 3 months prior to the application month if the person was eligible then?
Mm-hmm. It's about 90 days yeah.
Okay. So Alabama apparently has a gotcha highlight, and the Alabama's rules recognize that retroactive Medicaid for up to 3 months. Then they always put this, if eligibility requirements are met. So there's a timing and a process hook that becomes a trap in real life. So providers needing to act fast, right? So the doctors have to have less of a timeline and they can just take their sweet time, I guess, is what I get from it. What do you think?
Yeah, I mean, and that's, like you said, that's the gotcha, right? It's we'll give you these 3 months prior back because we know that we're not going to process this application as fast as we would like to. It's a gotcha.
Gotcha, right? And then you can't even ask. So let's say that the thing requires a prior authorization, right? So if I need to get a prior authorization and I try to go on the Medicaid website, they're going to tell me I can't get the prior authorization because I'm not enrolled. But then they say, oh, but you should have gotten the prior authorization, but I can't get the prior authorization because I'm not enrolled. So then what am I supposed to do? See the patient for free? I don't understand. I'm very confused.
And I think that's the reason why we're doing this is because we see it and nobody is talking about it, right? I mean, nobody's talking about the different minuscule things that create delays, denials, all the D's, right? Disclosures, discoordination. I mean, everything in credentialing that we try to avoid as professionals in this field, it creates those things. And so we are constantly playing by the rules of the payers when we're in these different states.
Okay, so let's look at it from the provider's angle. So delayed eligibility decision, then they can delay what? The claim, the payment?
Yeah, it just creates a cycle, I guess, of denial, delayed, timely filing.
Timely filing, they love using that word.
They love that, using that.
So then if they delay ID or coverage confirmation, then the office has to delay scheduling and seeing those patients.
Yeah. And it just creates these cycles that are revenue obstacles in you all's practices nationwide, but especially right now we're talking about Alabama.
And the doctors have to write it off because they can't collect on a Medicaid patient. Okay, so let's talk a little bit about the patient side of it and maybe educate patients into it's not the doctor's fault. It's not the MSP's fault. It's not the office manager's fault.
Well, that's the thing, right? When you go and you say, let's say you say, oh, I hear Dr. Smith is so great with kids. I want my kids to see Dr. Smith. I want my kids to see Dr. Smith. And then you go and you say, you call, hello, Dr. Smith. What insurance do you take? Oh, I take Blue Ribbon, and then it's, oh, well, we don't take that. Well, do you take Blue Ribbon First Choice? Oh, we do take Blue Ribbon First Choice. Well, why don't you take Blue Ribbon? And so, that's one of the things when you're talking about patient access, right? Because y'all, they make it hard.
So hard. So then patients get what? Delayed visits. What if they're pregnant? What happens with a pregnant woman?
Well, I mean, some states, they're scheduling people 8, 12 weeks out from the time that they call.
That's horrible. What if I have a cold? What if I had the flu?
Yeah.
So I have to drive 2 hours to find a doctor that takes my insurance because the insurances are just delaying and denying and delaying and denying?
Yeah, you really have to hope that the urgent care is in your area, and if you're in urgent care, make sure that you are taking every single insurance, because if you're not, again, that is hurting your patient's access in your area, because you never know if they're on blue ribbon, and that's just a made up plan that I like to make up, but I mean it's true, Nyleen, right?
Yeah, and then you can't control referrals, right? So like patients think, oh, Dr. Smith referred me to Dr. Jones, so I have to see Dr. Jones. Only Dr. Jones, you can't see Dr. Jones because he's not on your plan. So who actually decided the healthcare that's appropriate or the best for you to receive? Was it your doctor or your insurance plan?
Well, the other thing too, I mean, let's take it in there, right? So, I mean, healthcare it's people. Okay. And I understand everybody wants to be AI driven. Okay. So, even let's just think of an AI world and a person world. Right now, they see Dr. Smith's thing and they say, okay, well, did Dr. Smith check the blue ribbon 1, blue ribbon 2, blue ribbon 3? And even if they did the person check blue ribbon 1, blue ribbon 2, and blue ribbon 3? Because if the person misses it, that's why the doctor can't take blue ribbon 3. And then somebody like Nyleen, somebody like myself, somebody that you hire in your clinic has to call, figure it out. Well, we don't know. We don't know why. We don't see it. Why? Oh, you didn't ask for it. You have to be re-credentialed for it. Right, Nyleen? I mean, these are all the delays. It is just a game that is played.
I know. And the problem is that, Shannon, healthcare doesn't pause because of eligibility or because I forgot to check off a box. Because our bodies don't wait. Babies don't wait. Mamas, your pregnancy is only 10 months, right? 9.5 months, however many months.
Migraines don't wait, Cancer don't wait.
Cancer don't wait. Trauma don't wait. Car accidents don't wait.
Yeah, but what are we told? Please wait 2 weeks from the time you fill the application to call and see if we even got the application. That's literally what we're told, everybody, And so when you're thinking about it, how do you explain that to your doctor? How do you explain that to your hospital CEO? How do you bring that up at MSC when they're asking, when are these people becoming eligible? What do you do? And so one of the things that we always talk about what you do is make sure that you are gathering any signatures that you can gather in the beginning, all of the appropriate documents, that the data in your credentialing system is on point. So when you map out the applications, they're on point. That the rosters are on point before they're sent in if you're on the delegated credentialing, right? Any other advice we could give? What are you thinking?
Yeah. And then for patients, keep everything that's submitted, write down your dates and your names and your reference numbers. If urgent care is needed, ask the providers about charity care, payment plans, right? FQHCs, emergency stabilization rights. You have to inform yourself as the patient as well, right?
Yeah, of the different programs, the different ways, because they are out there. You just have to, like you said, educate yourself.
So let's talk a little bit about the Alabama State Board.
Oh, God, yes. Let's talk about it.
And we're talking about the medical board here. Let's discuss about discipline transparency issues, public lookup limitations, and how it's really like a low visibility state. So I'm a little scared because what that means is it's not really that transparent on the doctor board licensor stuff.
No, it's low visibility.
Right. So MSPs really shouldn't assume that no news is good news. It just might be it just didn't get reported yet, or it's kind of slow,
Or maybe that person has a special connection and so it's not on there because that connection has helped out, so just because, like you said, no news isn't good news. Dig.
Yes, dig. And something else that we found is that they don't have a large staff, I guess, working. And so there seems to be a large volume of files that they have to work, or doctors. And then it's just causing this bottleneck and kind of just packing one thing over another. So which leads to things being hidden or not fully disclosed or delayed. And so if you're an MSP in the state, we just want you to know you're not really behind. We understand that you could be, overloaded, that the workload might just be too much. And so that affects everything else, because for us from another state, maybe that is looking for, did the event get reported on the state? We may not find it right away.
But, if you are doing your digging, because as MSPs, we do a lot of digging. With the doctor's release, you can always query the board. So if you find something that is making you think something in the state of Alabama, or you see something came in from a hospital affiliation, that's where our minds, you start putting those pieces together. And you always can check the board independently and say, hey, have you had any complaints, actions, hearings regarding this provider? And with their release, they are supposed to disclose that to you.
Well, if our listeners stayed this long on the episode, girl, we've got some more tea, but this is why systems like Baton and credentialing programs like Baton are so important, because with the click of one button, I can get all 50 states all at once for a primary source verification that has allowed us to do some digging. So thank you, Baton, for allowing Credentialing Chronicles to use your platform and get some tea. So, I promised the listeners that I had to get some tea on some doctors, because me, I'm the crime girl.
Yes, I'm ready.
Girl, so Medicaid, if you think Alabama Medicaid is opaque, buckle up, because we're about to talk about who was trusted to care for incarcerated patients in the state. So apparently, there's a prison system situation that happens.
I could imagine.
Because this isn't a payer problem, girl. This is a who do we let back in the building problem.
Okay. Help me, Lord, help me. What is Nyleen about to tell me?
In 2014, an Alabama investigation revealed that there was 2 doctors that were previously disciplined for egregious sexual misconduct with patients that were later employed to provide medical care inside of Alabama state prisons.
It just seems like the people are always attracted to each other in the prisons.
Is that what it is?
Well, there are so much love that is found in the prisons. It's not even, I think that did you hear about the lady guard that broke the man out? I think they was in Alabama.
Yes. Maybe that's right. I forgot about that. Yeah, he ended up killing himself or something, right?
There'd be some love coming out of the prisons. Okay, so the doctors were getting with the patients.
Well, they had lost and surrendered their Alabama medical license for allegations of sexual contact with patients, trading controlled substances for sexual acts, fraudulent prescription activity, and repeated violations involving abuse of professional authority.
Oh, this was not just love. This was something else. Okay.
This was before they got into the prison system. But yet, girl, they returned to practice. Not in private clinics, but they went into the correctional facilities, treating some of the most medically vulnerable patients in the state. So I started with the first doctor. The second doctor, he passed away. So when I verified his license, it says deceased. But when you go to deceased, it does say the disciplinary action. So guys, when you go on the medical board, if you want to look up a medical doctor, you go and you just search for his name and you get the actual reports, like what happened and what they're thinking. So
the court documents, baby.
Yes. So remember, it was 2014. This was in the prison system, but the license action was for stuff that happened between 2007 to 2009, 2007, 2009.
Okay.
This one doctor, he had prescribed excessive controlled substances with no medical justification. He exchanged money for prescriptions.
In the prison or before the prison?
No, this was before they got into the prison system. Basically, yes, like the prison system let them in to work as doctors, even though they had this record, is my point.
Oh my God.
Yes. Girl, this doctor even impersonated another physician to call in a fraudulent prescription.
No.
He even had a prior felony charge in Mississippi for attempting to obtain drugs fraudulently. He was a full-on drug dealer, girl.
This is what he did.
Yes. So the board had stated on record, if you look it up, it says the continuation in the practice of medicine by Dr. XYZ constitutes a danger to patients and the public.
Yes, it does. Yeah, and the prison people, but they let him in anyway. So all of this happens, right? He's out here, he's stealing the drugs, doing the drugs, being with the drugs. And then they say, come on into the prison system and be a doctor here.
Well, what happened was his license was surrendered in 2009. But girl, he reapplied in 2012 talking about I'm a changed man. Yes, so that's 9, 10, 11, that's 3 years later. He admitted that he had had inappropriate relationships and drug problems, but his license was reinstated after agreeing to a treatment plan.
With a supervision on it, with something?
It just says, no, that he did a treatment plan, he got the help, and then he was later employed by the correctional facility.
Oh my goodness. And you know, the correctional facility, they don't have like a credentialing committee. They don't have that. They just see, it just goes up to one person. It's not like the way we think it is in the hospitals and stuff.
Yeah. So when I looked up the administrative complaint, it just says that, you know, it obviously says all the unprofessional conduct and sexual misconduct that he had. But then he wrote an explanation on his reinstatement, citing reasons for his answers, including admission of what he had done, being arrested in 2009. And so the board does have a credentials committee, and it says, after reviewing Dr. XYZ's application for reinstatement, the credentials committee recommended scheduling a hearing for the board. The motion was adopted. And so in 2000, and that was in 2012. And then in 2014, the removal of the restrictions placed on his certificate of qualifications for a license to practice medicine in Alabama was ordered. And if you verify his license now, guess what it says? Clear and active.
No.
Yes, clear and active. You can go to the public records and get his history, but yeah.
You have to dig for it. You have to dig for it. You are digging. And again, that's what Nyleen is talking about. As an MSP, you have to dig in the state of Alabama.
Yes. So let's talk about case number 2. So this other doctor, he is now deceased, rest in peace, but we can still gossip about him. So he had a pattern and practice of sexual misconduct. He had sexual contact with 4 patients inappropriately. He attempted sexual contact with a 5th. He exchanged drugs for oral sex, and he would kiss patients, fondle their breasts, and expose himself during medical treatment.
And what year was this?
So this was 2008. So in 2008, his license was suspended. He then admitted to his allegations. So because he admitted, you know, like the religion thing where if you repent, then you get forgiveness. Apparently the Medical Board of Alabama gets that too. Because in 2008, he admitted, Alabama is in the Bible Belt.
Yeah. Yes.
So his suspensions were lifted in 2009. He was then placed on probation with conditions. No sexual contact with any patients. That was his restriction. Sir, now we just have it in writing. You should not have sexual misconduct with your patients. And he had to have a chaperone when seeing female patients. Can we talk about that should just be standard practice? Why does it have to be in writing?
Yeah, why does it need to? We've literally have talked about this.
But then after that, he was hired by a correctional facility and a different one from the other one. So my question to you is, Alabama State Correctional Facility, what kind of doctors are you hiring?
Well, so I guess this is what we need to learn, right? Don't get arrested in Alabama.
So you know how you said the prison system doesn't have a credentialing committee? Well, actually, both physicians were employed by a health group. And then the system, the prison system has a $224 million contract to provide health care to Alabama prisons. So it's like a group, when you hire a telemedicine group,
hiring
radiology
agency,
services.
Yeah.
It's correct. So it's a health plan group that they have a contract to provide medical services. So these doctors worked for the same, were employed by this health group. What's interesting is this health group is the only bidder on this contract with the prison system. This same medical group is responsible for about 25,000 inmates across the state. And when the state officials were brought this story and we're like, what is this kind of like, who's getting this money? The state officials declined to comment. And then the health group's response says, we employ only those physicians granted practice privileges by their governing board.
The state. Yeah, that's what they're saying. Mm-hmm. And really, prisoners cannot choose their doctors, y'all. I mean, once you're in there, you're not choosing your doctor. You can't walk away. So let's say your ankle, tripped, hurt your ankle. The doctor start touching on your booty, start trying to kiss you. You can't get up and walk away. I mean, you shackle down. I mean, you can't report abuse even because that leads to like a risk of retaliation. And I mean, I know that they say medical care is often the only access point to safety, to getting help if you're in a bad situation. And so I think that, it seems like putting these type of doctors that should be chaperoned, that shouldn't even be practicing, into these situations is just really creating such a horrible risk, right? I mean, I see red flags everywhere.
And honestly, any past sexual misconduct, we have found doing this now for a year and doing credentialing for 20 years, we see that, what did we talk about? Patterns of behavior. So it's a permanent red flag. If you see someone, it's not just like a speed bump, like, oh, he just fondled a couple people, whatever.
I mean, if, and it's just like, oh my goodness, it's so aggravating, right? It's like they're struggling to track these people that are going in there and not having any type of oversight. You know what I'm saying? And then the patients can't provide protection to themselves. I'm all about a patient. A patient needs to know and be able to protect themselves and not become a victim. But in these situations, it's like, you really can't, Yeah.
And I think that correctional settings, like you said, they're trapped. So they should have like higher scrutiny and like not lower scrutiny, I guess. I don't know. Or maybe they just want to give the prisoners the worst of the worst. That's not right? I mean...
Well, I mean, when you think about a prison anyway, you get the worst of the worst, like deputies in there too. They be beating them and doing all kind. I mean, have you seen some of the stuff? It's just so sad that comes out of it. And they ain't tracking people. They ain't looking at people. They're not. I mean, are they giving performance reviews? I don't even know what they doing. I don't know.
I know, because when patients are incarcerated, they're really voiceless and they're fully dependent. And that failure isn't bureaucratic. It's really ultimately dangerous.
No, and I mean, to be honest, it's like Alabama is quiet and got some issues, honey.
Mm-hmm. Timelines are long.
The data is, it's out there and we see it, and we wanted to put it out here for you today because I think a lot of times people are not really looking at that and they don't even see it,
And interesting, because then the word licensed does not necessarily mean vetted, obviously.
Or safe.
Mm-hmm.
So, I mean, that's why you just, as a patient, you really, 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 really have to be able to walk into a provider's office. Have you had any board actions, doctor? Has anything been brought against you? Do you have insurance? You know what I'm saying? Are you using gloves, sir or ma'am? These things, you're allowed to ask for that. I know we've been taught in society the doctor is close to God because they can save lives, but honey, they also are close to man. Okay? They're close to man too. So we need to protect ourselves, baby. We need to protect ourselves.
Okay, so for our Alabama MSPs, if you are an MSP, if you are a doctor, you have to email us, DM us, tell us if we missed any drama, any gossip, anything from the state. We want to know how y'all are doing in Alabama. Do y'all have a association for medical staff, professionals in the state of Alabama? We would love to hang out with you guys. So tell us what's broken. Tell us what works.
Yes. And how can Alabama make credentialing better? I mean, that's really why we're spilling the tea across the whole America, is because we want to know in every state, what is your opinion? What are your throwbacks? What do you think? What have you learned? I mean, we are out here, you all, 5, 10, 15, 20, 25, 30. Who's got more years than 30? Y'all comment if you got more years than 30. But how do we make it better? And if we all put our heads together, right, Nyleen, what can we do?
Exactly. We can make change and try to improve the system and support each other.
Mm-hmm. Okay, follow, share, right? Stay with us. Stay with us. Don't leave us, baby.
Please don't leave.
Next week, we're heading into the next state. What is our next state? Do you know?
Alaska.
And we know the association from Alaska. We had her on Spillin the Tea at NAMS. Debbie, Miss Debbie. That's her name, Miss Debbie. Oh, okay. Well, we'll talk about Alaska next episode. This was all about Alabama, baby. We love you. Bama strong. Credentialing Chronicles out. Woo, that was a whole lot of tea. Who knew doctors had more drama than reality TV?
And if you think that was wild, just wait till next week. We've got more stories, more scandals, and more credentialing chaos coming your way.
And if you love the tea, please don't keep it to yourself. Like to show us you're listening. Please comment and join the conversation, and follow us on LinkedIn, Instagram, and TikTok. Also, share so everyone else can sip with us.
Yeah, so see you next time on Credentialing Chronicles. Stay credentialed, not canceled.